how we perceive pain, the side effects we get from medicines, and how bad our disease gets is directly linked to our mood.
So talk a little bit more about your mindset and how you, like, what are some other tips and tricks on how to find your happy?
I spend a lot of time with patients. And I like talking to them. I like talking to their families. I like talking. And so I spend a lot of time with people. And what I found was the people who, they're all getting medical treatments. They're in a hospital. The people who were happy and grateful and surrounded by family, they had amazing breakthroughs. Sometimes went home when we thought they couldn't. And the people who were depressed, alone, isolated, they couldn't even heal small wounds that I felt like should be healing. Like there was a slowness and sluggishness to their recovery. And then I had this amazing thing happen once where I was in surgery, and we had this one woman who had this terrible infection on her foot. She was diabetic. It was gangrenous. And every day they had to go in and scrape dead, infection off her foot. And I don't want to get too gruesome, but it was very painful. And every time we went in, this is a job they give med students and residents, like go and do the scraping, right? We go in every day and she would cry. And it was just horrible just because it was painful. And one day we go in, because we do this every day, and her daughter was there visiting. And her and her daughter were talking and laughing, and we scraped the foot and she didn't even notice. And so we came out and the attending was there. And I said, "Did you see that?" And what are you talking about? And I'm just a med student, so nobody cares about my opinions. But I'm like, "Did you see what happened?" And they're like, what? I said, "Well, she didn't cry." They didn't even notice. I said, "Did you see she didn't cry today? She cries every day. She didn't cry today because her daughter was here and she was happy and she didn't experience pain in the same way." And they're like, "You always are saying weird stuff, but the attending actually thought it was pretty cool. And so I started to realize how much of an impact our happiness made. And it reminded me of when I got my last chemotherapy. So when I got chemo, every time I got a treatment, they would raise the dose because they told me if they gave me the full dose of chemo right away, it would kill me. So they had to work your way up to tolerate more and more and more. So by the final dose I got after 2 years was the highest dose I ever got. Now, every time I would get chemo, I would get really sick. I wouldn't eat for a week because I couldn't stop vomiting. And then the second week, I'd just be afraid to eat. I remember my mom would have to use ice cream to tempt me to finally eat again, which obviously not good for me, but it was bad. I was in bad shape. So but I remember that when it was time for chemo, the morning I woke up, I'd feel queasy. Before I went in, I would feel queasy and kind of ugh. And then I'd go in and then they could never get the IV and they'd have to call the IV team and it was just a bad thing. Well, it was my last chemotherapy treatment. And I was starting college in a week. I'd gotten my first choice school. I got a scholarship to Carnegie Mellon. I was going to get to do genetic research. It was going to be so great. So I'm super excited. And it's my last chemo and it's been 2 years. So I am best mood ever. So I go in, I wake up, I feel fine. I'm like, it's a good day. Last chemo, getting done. Go in, they find the vein immediately. And I had 0 side effects. Highest dose I ever got. I didn't get any nausea. I didn't vomit, nothing. And I was like, what the? Are you telling me that if I was that cool and positive every time I walked in, because I'm a positive person, but chemo day was not a good day for me. I didn't like chemo day. So it was such an interesting thing. And it reminded me of that. And I went, how we perceive pain, the side effects we get from medicines, and how bad our disease gets is directly linked to our mood. I got to go into psychiatry. This is the most powerful specialty of all the specialties. Because if we can get people happy, they're going to have a better outcome with their disease, better outcome with their medications, and they'll have a better life because they're happy. So I decided to go into that. And actually, that was my thing. I said I wanted to be a Jedi. I wanted to be Dr. Jedi. I wanted to help everybody, and that was my first license plate when I became a doctor was Doc Jedi. I was going to help everybody with the Jedi mind powers to have a happy life. So yeah, that was my original goal. And I became a trauma specialist, and I've helped people recover from serious traumas and suicidality and teach them happy, because you have to actually know how to do it. Happy is not just something you hope for, you take a pill and hope for the best. It's a habit. You have to create those habits. And so I know those habits. I've learned them since I was a kid. And so I was to be able to incorporate that for people. And then I learned disease reversal and realized that happiness was necessary to accelerate disease reversal. So I do all of it. So yeah, I work on the brain, I work on the heart, I work on the food, and then that's what gets better.